back to another health talk, and today's topic is often left out of conversations with your friends or your family, but many people are going through similar experiences, about 80 million to be accurate.
It's insane. Hair loss doesn't have to feel hopeless or isolating. We're learning more about the causes behind it and treatments focused on regrowth with the help of Dr. Sonal Choudhary with UPMC's Department of Dermatology. Thank you so much for joining us. This is so important to talk about.
Thank you for having me.
My pleasure.
So what are some of the common reasons that people experience hair loss to begin with?
So hair loss can be with varied reasons. I say to my patients, hair and nails are actually somewhat of non-essential organs. So anytime your body is going through a big stressor of any kind, it will redirect its resources away from hairs and nails and to whatever is more important. And therefore they take a hit. Now it could be in the form of an autoimmune condition, an inflammatory condition like alopecia areata or lichen planopilaris that we see in our clinic, or it could be an interplay of hormones and genetics like we see in male and female pattern baldness. It could be something that a woman experiences after postpartum timeline. About 3 months after giving birth, usually you would see that they would lose a lot of hair, a lot of shedding, called telogen effluvium, can also happen from a number of other stressors.
Oh my gosh.
Yeah. The stress thing's making sense now.
Right, yes.
Stress is number one. Scalp infections, bacterial infections, fungal infections can lead to it. And certain hair care practices, cultural practices, very tight hairstyles, hairdos that pull on the hair can cause traction alopecia, or using a lot of chemicals and heat treatments can damage the hair. So there's such a variety of reasons that can lead to an inflammatory or non-inflammatory type of hair loss.
So we were talking before about how Heather and I both have experienced postpartum hair loss, which is enough to just throw you whenever you are in the shower, pulling your hair that never had ever fallen out in clumps, and it was just not something at all that you prepared for. Very. Yeah. But that obviously, there's no early sign to that. That just starts happening one day. Are there any early signs that someone could look out for that hair loss is kind of coming up and to get it looked at?
Yes, so in that context, being pregnant is an early sign right there, because when you're going to be, having in that postpartum period, something that we should inform our patients to be somewhat prepared for, but then overemphasizing that also makes people super worried, right?
Right.
The other early signs in other types of hair loss can be, shedding from other reasons. If you see more hair on the pillow or you see more hair in the shower, and people often would say, your textbooks say, or a source of literature says 100 to 150 hairs is normal to shed every day. But if that's not a person's own experience and they are just quadrupling or more of their hair, that is a concern thing. Or thinning of hair. So someone is noticing that their hair part has gotten wider, or they can see more of their scalp that they didn't see before. Hair is receding, the hairline is receding. Or the texture of the hair is changing because they have been doing certain hair practices that is making it more dry or brittle. And one of the really interesting ones is that if someone complains, my scalp is super dry and flaky and it was not this way, that could be a sign that there might be inflammation. It's not always that the scalp is dry and that's why it is flaking. It could be inflammation. And with that, the patient could experience sensitive scalp. They say my hair hurts, which is a weird thing to say, but it's like my hair hurts because the scalp is so sensitive or itchy or painful.
So are there any holistic ways to approach hair loss? We had someone on last week. We were doing this wonderful segment about wigs and trying to find some hair pieces. We had one woman who went through chemo and she was getting her hair back, but it was coming through thinner. So she's just trying to cover up. But are there holistic approaches to being able to get some of that hair to regrow?
Yeah, so hair problems, just like any physical problems, should be considered holistically. If you're just focusing on the hair complaint itself and not looking at all these other factors that affect hair, the person's social environment, mental health, other health factors, nutrition, sleep habits, lifestyle habits, you will not get the full result for that patient. So therefore, we always like to go holistic, and that demands a good in-depth conversation about what else is happening around you. If somebody's suddenly shedding hair and you haven't inquired about the postpartum situation, you'll miss the very important point.
Right.
So therefore, yes, the holistic approach asks for all these things. And in addition to that, at UPMC Dermatology Integrative Center, we will use things like even herbal remedies. We use traditional Chinese medicine, traditional Indian medicine, any kind of acupuncture, acupressure treatments that we can refer the patients out for, or any degree of multidisciplinary care with our traditional medical practices, with a rheumatologist, endocrinologist, psychiatrist sometimes, to make it well-rounded care.
That's wonderful.
That really sounds like you would have everyone in your corner, every member of the team helping the cause.
That's wonderful.
That really is, and especially
Thank you.
if you need the kind of help when you need it. Thank you for being here.
It's really great.
My pleasure.
If you're interested in learning more about the services offered by the UPMC Department of Dermatology, we'll have a link on our website, kdka.com/talkpittsburgh.
Coming up on Talk Pittsburgh, a healthy pet is a happy pet. Boaz is finding out more about the oral care necessary for our furry companions.